one thing that they have noticed, and this is now for several years, is something that they call the Hispanic Paradox, which is that Hispanics tend to have lower rates of the common cancers compared to non-Hispanic whites. And that has been attributed perhaps the mix that we have, and perhaps some genetic strength. But that is for the most common cancers. However, cancers that are related to infections, cancers that are related to screening, and things like that tend to be more common in Hispanics. So the chances of you having a cancer in your lifetime is between 1 in 3 and 1 in 2 in certain cases of males or so. So cancer is here, is high. We need to do what we need to do to prevent it, and when you're affected, to try to treat it as early as possible, and when it's late, with the best medications that are possible. Well, we have a lot of fine oncologists that will be here to see any patient that they have been diagnosed with cancer. And we have opened the doors in a way that will accommodate those patients as soon as possible to be seen and to be treated. We also do high touch, not only high tech. We'll be here with the clinical trials, we'll be here with the technology, but also we'll be here with the support that patients and families need. And then, of course, there is a component of education. So, like I mentioned before, the best cancer is the one that you don't get, and doing the screening to find them early is the other part. So, we're here for you, at any time that such bad news, might come.